Okay, so discussing the hip anastomosis, there's two different anastomoses around the hip joint, which are the trochanteric anastomosis and the cruciate anastomosis. You can remember the trochanteric anastomosis, it's next to the greater trochanter, so just remember that the greater trochanter refers to the trochanteric anastomosis, while the cruciate anastomosis is close to the lesser trochanter. Okay, so let's first go back to the common iliac artery, which you see here. The common iliac divides into the external iliac and internal iliac, and you know that the external iliac becomes the femoral artery after it passes the inguinal ligament. So first let's talk about the internal iliac for just a bit. So looking at this picture here, we can see the internal iliac artery right here, and then you have, it gives off two different divisions, the posterior division and the anterior division. The posterior division gives off the superior gluteal artery, which is the one that you need to know here, and the anterior division gives off the inferior gluteal and also the obturator artery. Okay, so let's go back to the picture here. So those are the branches of the internal iliac, which you see here, the superior gluteal and the inferior gluteal, which are a part of the anastomosis. And then looking at the external iliac, which becomes the femoral artery here, it gives off a branch called the profunda femoris, or the deep branch of the deep femoral artery, which might resemble the profunda brachii from the upper limb. This profunda femoris gives off two different branches, which are the medial and lateral circumflex arteries, and it also gives off four different perforating arteries. The only one you need to know here is the first perforating artery. Okay, so going back to the medial and lateral circumflex arteries, they give off here. They give off two different ascending branches, which are this and this, and they also give off two different transverse branches, which are this one and this one. Okay, so that's for the branches. Now, if we talk about the anastomosis itself, first we have the trochanteric anastomosis over here. The trochanteric anastomosis involves four different arteries. First, you have the superior gluteal here, and you have it's like a branch of the inferior gluteal here. Sometimes the superior gluteal is called the descending superior gluteal. It's just the same artery. They call it descending because it goes down. It goes downwards. And then you have also the ascending branches of the lateral and medial circumflex femoral, which is this one and this one. So if you look here, the trochanteric anastomosis involves the descending superior gluteal. Like I told you, it's just the name for the artery. And you also have the inferior gluteal. And then you have the two ascending branches of the medial and lateral circumflex. Okay, and that's it for the trochanteric anastomosis. Now let's take a look at the cruciate anastomosis, which is right here. It involves first from the top a descending branch from the inferior gluteal artery. So the inferior gluteal is a part of both trochanteric and cruciate anastomosis, but the superior gluteal is only a part of the trochanteric anastomosis. Okay, and then you have I told you this artery here is called the perforating, or the first perforating artery, and it gives off an ascending branch which contributes to the cruciate anastomosis. Okay, now you have two more branches left, which are the transverse branches of the medial and lateral circumflex, which are these two here. Okay, and those are the four different arteries that are part of the cruciate anastomosis. So again, the ascending branch of the inferior gluteal, ascending branch of the first perforating artery, and then the two transverse branches of the medial and lateral circumflex arteries. So another picture here, which is like a more simpler picture or a demonstration. Again, here the trochanteric anastomosis, like I said, involves the superior gluteal, the inferior gluteal here, and then the two branches of the medial and lateral circumflex arteries. And then the cruciate here, involving the descending branch of the first perforating artery, descending branch from the inferior gluteal, which is this one, and then you also have branches from the medial and lateral circumflex arteries. Okay, so looking at this question here, the woman undergoes hip surgery. If all of the arteries that are a part of the cruciate anastomosis of the upper thigh are ligated, which of the following arteries maintains blood flow? So the question is basically asking which arteries here are not a part of the cruciate anastomosis. So just take a couple of seconds to recall which arteries are a part of the trochanteric anastomosis and which arteries are a part of the cruciate anastomosis. Okay, if you answered C, it's correct. The superior gluteal, like I said, is not a part of the cruciate anastomosis. The cruciate anastomosis, again, involves the descending branch of the inferior gluteal, ascending branch of the first perforating artery, and the two transverse branches of the medial and lateral circumflex. And that's it. Thank you.